Okay, welcome to the committee. Please state your name and proceed.
You bet. Thank you for this opportunity. My name is Cara Schulz. I am a sitting city council member in Burnsville, and I was asked to present testimony on behalf of residents who had contacted me. I'm also a stage 4 colon cancer patient, and I'm involved in several support groups for colorectal cancer patients, and I've been asked to relay how this bill impacts them as well. This bill is premised on some false assertions, the first being that patients under the care of their doctor become addicts, that the Minnesota Senate is more qualified than medical teams to decide how, when, and what medications a doctor prescribes for their patients, and the conflation of prescription opioids with illegal street drugs. Less than 1% of those who are screened for drug problems develop new addictions during pain care. It's not an opinion. That's backed up by studies. Drug-related deaths for people who take opioids prescribed for them in Minnesota is 2 per 100,000. To give an example of risk assessment, taking a daily aspirin regimen has a mortality rate of 6 per 100,000. Now, we all agree that there is a problem of addiction to illegal street drugs in Minnesota, but the solutions proposed in the bill may have unintended but not unforeseen consequences. And we've already seen some of these unintended but not unforeseen consequences as a result of the 2016 CDC guidelines. An estimated 6,070 people kill themselves each year due to unmanaged pain, and the CDC acknowledges that this number is climbing after their guidelines were adopted. Cancer patients were told that these guidelines would not affect them. And right now, some late-stage cancer patients, cut off from their opioids, are entering hospice care early so that they can have their unendurable pain managed. To enter hospice care, you have to stop active treatment. You have to stop fighting your cancer. Cancer patients are also turning to street drugs. A gentleman I know by the name of Mike has led a fairly normal life, and he's now retired. He has stage 4 colon cancer, and he can get his prescription pain medication, but he can't always get a pharmacist to fill it. So he did something he never thought he'd ever do. He bought heroin. He doesn't even drink alcohol, and he's never smoked a cigarette in his life. And in telling me about it, the shame and puzzlement in his voice as he said, "How did my life become this?" We also recently lost one of our support group members. Sarah had good days while she still had access to pain control, but that ended when her active treatment ended. Since she was no longer in active treatment, CDC guidelines, and also, according to how this bill is worded, you're proposing cut her off. She left her doctor's office and she killed herself. Now, this is not unusual. Discussion amongst members in cancer support groups are now focusing on suicide plans when our pain medications are taken away and we are abandoned to suffer. And it's not just the actual torment that you personally will endure. What is driving these discussions is what our families will endure. They're going to be forced to watch our pain levels grow. Our spouses, our children are going to watch us beg them to do something to help us, and they're not going to be able to do anything to help us. And once we die, and rest assured, by the time your end comes, they'll be praying for you to die. They're going to have to live with the guilt of that helplessness. Now, these consequences are already happening, despite being promised that these unintended but absolutely foreseen consequences never happen. And despite having specific language in the CDC guidelines that should have barred these things from happening. And that's why when proponents of this bill say to us, trust me, it won't happen. No sane person can put any faith in a promise. Now, media coverage of this issue is changing, fortunately, and we're starting to see headlines like, "Crackdown on opioids has its own victims, people who need them to live." Yahoo News, that was today. LA Times, "Don't drown out the voices of chronic pain sufferers amid the opioid crisis." New York Times, "When the cure is worse than the disease." And the coverage will increase, and if you advance this bill, the increased coverage is going to be local. It will be your friends and your neighbors in the news, your constituents. And as elected officials, especially when legislating matters of health, we could do worse than use first do no harm as a guiding principle. And this bill will harm Minnesotans. So table this bill. Let the new federal Support for Patients and Communities Act play out, because you can always reevaluate. do not support SF 751. It is a very good intentioned bill, but it's filled with long-lasting, costly, and easily foreseeable consequences. I thank you.
Thank you. Mr. Lowe.